Hello, and welcome to Connecting with Kathleen. We're a show that highlights local nonprofits and behavioral health agencies, informing you of services that are available to you down the Roaring Fork Valley. And today I have Braulio Jerez,
yes.
A police officer with
Aspen Police Department, yes.
And with PACT as my guest. So we're going to talk about the PACT program. If you could tell us what that is.
Well, PACT is a program that was established in 2019 with Pitkin County. It's Pitkin County, Pitkin Area Co-Responder Team, PACT. And that program was to pretty much work alongside law enforcement to assist individuals in need, be it substance abuse, mental health, our homeless population, unhoused, or our senior population, just creating wraparound services for that community. And what PACT does is pretty much respond with law enforcement to calls for service, welfare checks, wellness checks, things of that sort for individuals in our community in Pitkin County, and just create that wraparound service support.
Okay.
Yeah.
And I understand you're the main police officer that takes those calls.
Yes. So I, since 2019, I've been the Human Services Officer for the Aspen Police Department. And pretty much the best way of explaining that is social worker cop. I do law enforcement work as well. I take cases, but my job title is Human Services Officer, and that's what I mainly do. We just work alongside the community and our nonprofits for these wraparound services and supports to local individuals in our valley.
Yeah. So we were talking a little bit earlier before we went on air about how different it is to be a police officer kind of thrown into the world of being a social worker. Can you speak a little bit to that, how you've been trained? And I think you are natural at it, but you can speak to that.
Thank you. So all officers in the Upper Valley go through CIT, crisis intervention training, mental health first aid, just a variety of different trainings for dealing with that type of population that is struggling with crises or mental health struggles, substance abuse struggles. So all our officers are trained in that in the Upper Valley. I would say Pitkin County, Snowmass, PD, as well as Aspen. That transition from just the typical law enforcement duties to a social work type of mindset was a shift for me. It's a lens shift as well. Okay. I saw the world through more of a social work lens at that time. And again, I've been learning for the 5 years that I've been in this position more and more about, because I don't have a degree in social work at all, one day maybe. But I had this shift, that mindset of, okay, are there other options for individuals? Let's get people out of the judicial system. Let's decriminalize the mental health and substance abuse issues that we see up and down this country, this nation, this city, this town. And that was our goal, is to have the ability to advocate for individuals that are struggling with this or that, and support and work through the courts, work through the jails, so it won't be as cyclical as it has been in years past.
Right, so probably cutting down the recidivism rate for some of this.
Exactly. Yeah. But again, it was a shift in mindset and approach. You don't sign up to be a police officer to be a social worker as well, but more and more, I would say, even pre-COVID, we've seen a shift in the national mindset, but here locally, for sure. I would say that the PACT program and my position, we were the first rural county in all of Colorado to start this program. So we are pioneering pretty much this type of service. They do exist elsewhere. I go to a conference every year, the co-responder conference.
Oh, great.
In different states. They have them. Next year is going to be in Atlanta, Georgia, and I hope to be at that one as well. But I've been to 4 of these conferences in different states, and you learn a lot about how other states and municipalities and towns do this type of work. It's different models at different locations, but this is how we do it here: law enforcement and a clinician through the PACT program.
And it seems to vary from law enforcement, where law enforcement traditionally is very black and white, right?
Agreed.
You're speeding, you get a ticket. And I had a friend pulled over about 6 months ago and said, visiting friend, those Aspen police officers, the first thing they did is ask me how I was doing. Was I having a rough day? They didn't even talk about the speed at first.
That's amazing.
And they felt that they were treated like a human being.
Yes.
I don't want to put a bad word on law enforcement, but I think that's what you guys are known for in this area, is kindness and being human first.
Yeah. You mentioned something about black and white. I like to say that we play in the gray. A car stop is a great example. You know, even before becoming an HSO, I would pull people over and ask them, "Hey, what's really going on?" I would start with that before, "Hey, do you know what you did?" You know, I would just ask, and sometimes you would have like a breakdown. They're struggling with their partner, they have a new baby, whatever it may be. But we try to take that humanistic approach. Aspen PD was nominated this year as the #1 police department or law enforcement agency in all of Colorado.
Oh my
So
gosh, that's amazing.
we do treat people the right way. We're empathetic, we're sympathetic, we do listen. Thankfully, we have the time. I can't speak to bigger cities and bigger agencies, but they're busy. And sometimes, even with the desire to help, they really can't because they're going from call to call to call to call. We have similar situations at times, but for the most part, we are allotted that time to communicate, to talk, to sit down, to say hello, to have a conversation, not just about what's occurring at that point, but learn a little bit more about the person. And thankfully, we have that opportunity.
Yeah. And you have a wealth of knowledge for all the nonprofits and other agencies that can provide those fill-in services that maybe someone at a speeding ticket starts bawling because they're having a fight with their husband and they need support, right?
Yeah. Yeah, I mean, working with the local nonprofits, which, I mean, I can name several, Headquarters, Mind Springs Health, Hope Center. There's so many in this valley that a lot of people don't know about and are afraid to use them, you know,
Right.
these services. For those listening out there, you know, Medicaid is a big thing. Insurance is a big thing.
Yes.
Well, the great thing about the PACT program and other programs and nonprofits in our area is that they have case managers that can help an individual get that insurance that they need. Medicaid is prorated 3 months prior, so once you apply, whatever you had done 3 months prior may be eligible for that insurance coverage. Don't be afraid. Undocumented people, especially children, there's services for those individuals as well that they don't have insurance, you know.
Right.
So
There's a lot of grants and mental health funding that people don't know about and don't know how to tap into.
exactly, yeah, the Mid-Valley Family Practice with Jared Rollins, you know, there's just so many different entities in this valley that people do not know about or are afraid to engage with. And they're missing out on opportunities for support. There's, you know, the stigma behind contacting law enforcement, especially in our Hispanic population, and because of the fears from living where they grew up, whatever country that was. They don't communicate with law enforcement. Thankfully, I'm a Spanish speaker, and I can bridge that gap and say, hey, you have options out here, undocumented, Spanish speaker. The language is not going to be a barrier. The stigma is not going to be a barrier.
That's awesome. So let's talk about a well person check. I know we had you come speak at Hospitality Matters several years ago.
Yeah.
And you presented that, and people were like, I'm not calling you guys. I'm not going to ever call you because my friend might get arrested.
Exactly.
So can you talk about what the nature of a well person check is? You know, what that call would be and then what y'all do?
So, yeah, let's say someone calls law enforcement, they call 911, and they want to check on their friend, their neighbor, whoever it may be, a family member. I would respond, or another officer, and check on that person, find out what's going on, if it's a mental health need, a substance abuse need,
So
if there's drugs,
But
let's
how does
say.
that happen? You're in a uniform, and a lot of people are still intimidated.
Yeah.
And how do you bridge that?
I think building rapport is something that I excel at.
Yes.
I guess a smile and just being able to listen, being able to be vulnerable are opportunities to engage with folks in our community. if they may see all this, which I will explain. I have all these things on me, but I only see these as tools. They're only tools. I don't use it. I don't see a gun. I don't see all these things that I have. Taser. These are all tools that I may have to use. But honestly, what I use the most is up here and right here. Right. I will try to talk my way out of mostly anything, or help another individual with that. My desire to put handcuffs on someone is not something that I think about as frequently. You know, it's only when you're pushed to that limit. But honestly, if I can talk through it, that's my approach. That's my goal.
So you have a really amazing talent at holding space for other people's emotions.
Yeah, I think that was something that I developed. It doesn't come easy for everyone, I would say. I have a desire to help. So I'm able to listen. I'm able to really focus in on what an individual actually needs. And I will be completely transparent. I struggle with that because I do talk a lot and I speak a lot. And sometimes I want to say something to interrupt the moment. I've had to scale that back and learn that, you know, just you're here to listen. And then when that person's ready to hear you, then you say, hey, these are just options that you have. I can give you this. I can put you in touch with that. But again, it was challenging at first, but it's something that I developed with the years of working in this field.
Right. Yeah. So I've had people talk to me and say, okay, my friend, I think they're suicidal, but I'm pretty sure there's some coke on the table. I can't call the cops or they're going to get arrested. Can you speak to that?
Well, I mean, Colorado has a Good Samaritan law. So let's say you do have that friend that is abusing, illegal drugs. That's something that when we're going to a wellness check or to a residence, we'll go there, we'll see that there. Our main goal, let's say that this person is overdosing. Our main goal is to protect life, to make sure that that person is okay. I will say that, there's an operation, a drug operation there. That's something that we can't really just like turn a blind eye to. Right. But our main goal at that moment is to help that individual out, whatever they're going through. If they're, like I said, overdosing, I'll make sure that we're educating people on Narcan and how to use that, fentanyl test strips and how to use that appropriately. That's our goal, is to educate, to help, to assist. But yeah, the Good Samaritan law does assist with that, where you call someone in and there is coke on the table, you're not automatically going to get arrested. I think that's not our goal. We will, if it was a bigger operation, then something that we have to look into. But yeah, our ultimate goal is to protect life, save lives.
Excellent. So, do you have any anecdotal stories of calls you've been on, so our audience has an idea of, what to call in for, what that looks like more in a story?
Sure. I can give one example. Actually, at Hospitality Matters last year, or was it probably last year or this year, I came by one of your meetings, and I spoke to someone that was there, and they mentioned that the reason that they called law enforcement was because of my first time that I went to
5 years ago.
Yeah, about roughly 4 or 5 years ago, to Hospitality Matters and speak on what we do. And because of that experience, that individual kept my card, and when he had a friend in need, he contacted us. And he doesn't know if I responded or not, but he was comfortable enough to be like, I know my friend is doing drugs, but I'm worried about them. And he called law enforcement, and we responded and assisted his friend in getting the resources and support that they needed. That's one story. When people go into crisis, let's say, we have the Hope Center responding. They have a contract in Pitkin County to respond to crisis calls. But our PACT team does as well. They have the ability to triage those situations. A crisis incident doesn't always lead to hospitalization. Sometimes they have this thing called a safety plan. The safety plan allows an individual to create a framework of who they have that's going to call them, that's going to reach out, how they're going to reach out, so we don't have to go to the hospitalization route if we don't need it. So when you call on a mental health crisis call as a friend or family member, it doesn't always lead to hospitalizations. And I want people to understand that you know, you call the cops, mental health responder, crisis clinician shows up and evaluates the individual. It doesn't always lead to that. Safety plans are something that are incorporated. My experience with safety plans is that some people use me as their safety net. They'll contact, I'll be one of their contact points on their list of individuals that, hey, if I'm struggling, can this person be my go-to person? So because I've developed that rapport over the years, people trust me enough to be their person. It's a lot.
It is.
It's a lot of responsibility, but sometimes more than happy to assist in that if you have that much faith in me as an individual, not just the uniform, just a person.
Well, and that's so important, especially post-COVID, because people stopped communicating. And, you know, our number one epidemic is loneliness. And to get a safety plan where you're making that person think about who in your life would be willing to step up.
Sure.
And they're not used to thinking about that.
Yeah.
And then suddenly we've got some connections again.
Yeah.
It's a really beautiful thing to see.
That did exist post-COVID and during COVID. We had that isolationism, especially with our senior population. Our senior population truly struggled with that isolationism. That they could typically go to the senior center and get a meal and have that camaraderie and meet with people that use those services as well. Right. They lost that. And so we were busy during COVID, surprisingly enough, and meeting with, especially with the senior population. We were working a lot with them because that's isolationism led to depression, substance use, mental health conditions that weren't the biggest issue then, but became because of that. They lack community. They lack community.
Right.
Yeah.
And then speak to the end-home population that we have here and how PACT works with them.
I missed it.
Homeless?
Homeless. The unhoused. So I will say that on average, over the years since I've been a law enforcement official here in Aspen, just started my 12th year, and 5 years with as an HSO. I've worked with this community for several years. I was actually part of the group that created the safe outdoor space out at Brush Creek Lot. I supported that with the assistance from the county because the county did allow me to go because it's out of Aspen jurisdiction. Right. But I had a good relationship with the sheriff at the time and our current sheriff where I can just go there and interact with those folks. There was up to 30 people living there at one point at the Safe Outdoor Space, the SOS. And that was all unhoused folks that were living there during COVID specifically for approximately 18 months. And all the services were funneled into that area where case managers would go there, peers would go there, and just work with that community. I know most of these individuals in our community by first name, last name, their stories, and I have a pretty good relationship with the majority of them. I'm not saying even with the smile, I'm not always liked by all, but I will say that because of my ability to work with these individuals for several years, they'll stand up for me. If a new guy just shows up in town and uses some explicit language about officers or about me specifically as an officer, they're present, I'll have these guys. They have my back, which I've been able to develop over the years. So I have a really good relationship with our unhoused folks because of all the years I've worked with them. They trust me, I trust them, and I'm able to work with them. I'm not going to say that they don't get in trouble still and they don't have their own issues, but I always try to find solutions if they exist.
And if they're willing to use those solutions.
That's another thing. A lot of this engagement has to be on both sides. Right. I'm willing to offer these resources and supports and services, but you have to be ready to receive those as well. If individuals aren't there yet, we'll keep on working with you. I'm not one to quit, that's for sure. Right. But if they're not ready, it's not going to happen. It just doesn't happen. Right. But we're there. We show up. We constantly show up.
I think that's a good point, because somebody's afraid, like, I have a mental health issue, but it doesn't qualify to be hospitalized, and maybe I don't want to go get help right now. We can't make you get help.
Exactly. And
we can encourage.
As much as I would, be able to have that ability to just like, hey, I'm going to move you from here to there, and I know this is going to be great for you. I can't. I don't have control over that. People have rights. People have their belief system. I can't force that on anyone. But am I going to be there when they are ready? Am I going to continue to work with that person? Of course. I don't quit on people.
Yeah. Well, I think if people know that PACT's not going to force you into treatment.
No.
They can relax and
Yeah.
maybe actually hear. Like,
Yes.
you're not going to make me do that? Well, maybe I'll listen.
Yeah, and that's a great thing about we do a lot of education. Myself and the PACT clinician Kat do verbal de-escalation for any of the nonprofits and local agencies here locally in the Upper Valley. We are able to do that to talk to people that have to interact with folks that are struggling with whatever it is, on how to handle those situations. So we offered that training, and when we're on these wellness checks, these welfare checks, we're educating people on what's available to them and how to go about it.
That's awesome.
Yeah.
How many calls do you get a year?
I don't have that data with me, but I do stay busy. I would have to reach out to the PACT coordinator that manages the grant, Raleigh Bakra.
Oh, yes.
She would definitely have that information, but it's substantial. We're busy year round. Off season we're very busy, surprisingly enough, from our locals that are struggling with not being employed, not having health insurance.
Right. Fear of losing their housing because the restaurants are closed down.
That's the tough part of living in this type of community is that, not everything is year-round. Sometimes it's just seasonal work. It's tied to your housing. It's very scary, but there are options out there. There's support out there. There are services out there that you could take advantage of and create community, have that tool set for you to be able to manage that. Don't be afraid to call us. We're not the bad guys.
Well, sometimes it takes that one person to be the intermediary, like to say, okay, here's this agency. Do you want me to help you make that phone call?
Yeah.
Right? Because sometimes they won't make that phone call.
And a friend, I can be there, a case manager, a peer. We have so many different individuals that can assist in that process. Whoever you feel comfortable with, let's make that phone call together. Let's, if you're struggling with substance use disorder, we can call and get you into a rehabilitation center. We can get you set up with Medicaid. It seems very daunting, but there is help along the way. You don't have to walk that path by yourself.
Talk about your peer counselors, peer
support.
Peer support.
So PACT has peer support specialist, a peer specialist. That's an individual with lived experience that, be it mental health, substance use, whatever it may be, they fought that fight. They learned, they got certified as a peer specialist, and they are not clinicians, so they're not going to give you all that information about what you're dealing with. But what I will say is that these individuals, because of their lived experience, can guide, can assist. They, help you do grocery pickup or grocery shopping. It all depends on what your situation is, but the peer is there for all these things.
Right.
Yeah.
And I've met some of them. They're wonderful people, and they do this because they want to give back. They want to help somebody walk the path they walked to a better life.
Exactly.
Right?
And there's different approaches. Like both peers. We have Dan Hess. Dan Hess has, he's a vet. He's a vet, so he has that experience, that life experience, and he caters to that group, but not only that group, but he has that lived experience as being a military veteran that can help that segment of the population. Otis also has his own lived experience that he can help a different sex. So we have people that can fill a different niche, I would say, but all are willing to help in one capacity or another.
Trying to fill all the gaps of this
exactly.
valley and the needs that we have.
Yeah.
Excellent. What's your favorite thing about being in PACT?
I would say my favorite thing is the good and the bad, but I get someone into or assist someone in getting into a rehabilitation center, or get a person a job. It's the help piece, the offering of an opportunity to make a shift in that person's life. It doesn't always, I don't always get the wins, but I'm not a quitter. So we may not get a win today, but we may get a win down the road. But it's planting that seed, you know, and having the ability to be helpful and assist and support and encourage, advocate. Those are all the great things that come with this type of work.
And you're very persistent, because I've had neighbors and clients who've worked with you that you don't give up. You come back.
Not a
Because
quitter.
I'll hear like, I talked to Braulio. I'm like, really? That was months ago.
Yeah. I follow up a lot with people that I work with. You know, that list has gotten a lot bigger. So I may miss people here and there, but ultimately I do come back around and reach out to an individual like, hey, how's it going? What are you up to these days? You know, so it's not always about the crisis situation or the wellness check.
But you've made that connection, so it makes sense that you just want to, as somebody in the community who cares about you, just say, hey, how's it going? And you really mean, how is it going?
I have individuals that I've been working with since I started this position that I talk to almost weekly.
That's
I have people that
wonderful.
have left the community and have gone elsewhere
And
that I
still-
still talk to
awesome.
periodically. So, yeah, I'm an open door, and I want people to reach out and tell me about how they're doing, the good and the bad.
Awesome.
I'm not here to judge. That's one thing I've
don't
learned
do.
too.
Yeah.
I'm not here to judge about what you've done in your life and what's happening currently. But if you need the help, I'm here to offer it.
Oh, I appreciate it. Well, Braulio, I appreciate you being with us today. Thank you so much for your time.
Thank you for the invite.
All right. And
Yes.
if you have a person who's struggling, you think might need extra help, please call Aspen Police Department.
Yes.
Don't call crisis unless it's a crisis. You can ask for the PACT team, and they will respond.
Yes.
Correct?
So PACT is tied to our dispatch. So PACT will respond with law enforcement no matter what, because they are tied to law enforcement and
Right.
dispatch 911. But there will be someone there. You
Yeah,
know, we will answer. We will call.
Yeah,
we
you're
will.
there. All right. Well, thank you.
Thank you.
All right. And thank you for joining us today. And I'd like to end with wishing you health, healing, and happiness.